It's currently an
Thank you.
opt-in system for disability workers. Is it working?
Well, what we know is the opt-in approach isn't working. It's not working for about half the disability support workforce. What they need is the extra nudge, that extra little push that a government mandate would provide. That's what our members are telling us. That's what we know will keep our clients, our staff and the entire community safe. And we've seen that with the aged care workforce. A government mandate works in providing that extra nudge, that nudge beyond vaccine hesitancy for a big chunk of that high-risk workforce.
You mentioned it's working for half of the workers. Are you saying that there's been about a 50% take-up so far?
Well, I think it differs across our membership. So we represent the largest grouping of health, community service and aged care not-for-profit providers in Australia. Some of those providers have lower levels of coverage, some higher, but generally, yes, we are hearing about 50% is the watermark that you reach with an opt-in approach. To get beyond that, you really do need a government mandate. And as I said, we have seen that, the success of a government mandate in the aged care workforce, and we need to provide a similar benchmark for disability support workers. As with aged care workers, they are engaging with some of the most vulnerable members of our community. They're engaging with people who are at high risk of severe illness and sadly death from COVID. We know that, for example, from the news today. And we know that they're a highly mobile workforce. So they're moving in between indoor environments where there is a higher risk of transmission of COVID. All those factors coupled together mean that it really is quite urgent for a government mandate to require vaccinating disability support workers.
Are you finding that some clients are specifically requesting only vaccinated workers?
I'd have to get some more advice from our members about that, but certainly we can see from public reporting in the community that there are lots of people in the community very concerned about unvaccinated people coming into contact with them. And I think that concern has to rise as we're opening up. So it's good news for many people that we're seeing some loosening of restrictions in Victoria and New South Wales. That's heartening news for many. But I think we can't lose sight of the need to protect people who are vulnerable in the process. And the best way of doing that is getting the jab. The best way of ensuring people get the jab if they're working in a high-risk occupation is a government mandate.
Are you worried what might happen to the workforce should a vaccine mandate be put into place? Earlier on in the piece, when there was an aged care mandate, there was concerns that people would simply leave the industry and the industry would be left vulnerable. Are you worried that that could happen in disability care?
Well, I think going to the aged care workforce, the evidence is there that the government mandate has been a huge success. There has not been significant loss of the workforce from that sector. Obviously, a mix of approaches needs to be taken. If we see a government mandate, then it's also incumbent on us as employers to be working with our workforce to ensure they're educated about the benefits of vaccination, to ensure that they're educated about the benefits of vaccination for them as people. So I would hope that anybody working with a client with disability has a really sincere desire to help their clientele and protect them from the risk of COVID. We also need, of course, to appeal to people's self-interest here, which is that being vaccinated will protect you, will protect those workers from the risk of severe illness from COVID too.
Absolutely. And of course, today is D-Day for healthcare workers to have their first dose. There's only estimations that a very, very small number simply haven't got their first dose yet. Do you think that the timeline needs to be extended to give people a little bit more time?
Do you think, are you referring to the timeline for healthcare workers?
Yes.
If that's the case, then certainly not. So if you're working in a hospital in an acute setting, you must be vaccinated. One of our major members, St Vincent's, issued a vaccine mandate covering all their staff, I think only a week ago. So not only their staff within hospitals. I think if you're working in a hospital setting, you need to really be considering the common good. So I understand that some people might experience vaccine hesitancy. That is no excuse for not getting the jab if you are working in a hospital in our community.
Rebecca Burdick Davies, we have to leave it there. Thank you for joining me
Thanks.
this afternoon.
Thanks for having me.